Hey guys, welcome back to the channel. This is Side Dental Vlogs, and today I'm going to say something about root canal. How many days do I take to finish my root canal? How many sittings basically? So, usually I take around 4 to 5 sittings. All the carious cases which are coming to me are, I don't know, it's infected for me, or I don't know, I'm very like in a year I have done only 2 single sitting RCTs. I'm telling you the truth, but was even after doing the best BMP in the very first sitting and doing very nice calcium hydroxide placement in the second sitting, third sitting also somehow I don't get convinced because the patient has a little bit of pain. Like 90% of the cases, I am finishing in the third sitting, the root canal. I do the entrance filling on the very same day. I do the crown cutting also on the third sitting, and the fourth sitting, I deliver the crown. So, usually, my average is 4. Whatever root canal I have done early or fast or taking very less time, those root canals have ended in failure. I'll tell you when I do root canal in just 2 sittings or 1 sitting, and in which cases I do a lot of sittings. So whenever a case comes with an attreated tooth, attreated tooth, the canals become very thin, and it's very difficult to perform the root canal. So in those cases I finish the root canal in 1 sitting because the tooth is nowhere infected from external sources. There is no caries lesions, and what I'm doing is I'm just removing a healthy pulp and remove and replacing it with Gatapaka. So I am replacing it, I seal it off. So last I would did it from one of my teachers, and went pretty well. Sometimes even if the patient is going abroad or is going sometime somewhere out of station, I tell the patient, okay, you come up whenever you're coming next year. At that time, I'll be finishing. Because recently I did one RCT for one patient who stays in Pune, and she came last year, and I just gave calcium hydroxide dressing. Above that, I gave a permanent filling as well because after placing some cottons, and I told her, ki, we'll wait, and I did a very nice filling for her. She came back again. This time I filled it properly with obturation and gave her a crown also. She was quite happy. And so why I do this? Because the chances of failure are less. In my clinic, the root canal failures are very, very less. Like once in a year, patient will come or it never comes also because I am taking long sittings. The only thing hampering is like it's hampering the patient's time because they have to come for me and they say, sir, सब लोग तो root canal एक sitting में कर देते हैं. Why you are doing so many sittings? So usually I never get satisfied even if I see a periapical abscess, a big abscess, and I even if it's the best obturation, I still give time to the patient. I give calcium hydroxide dressing because the pH of calcium is very high. So when you give calcium hydroxide, we only give for 3 4 days. So actually, it has to stay in the mouth for minimum 15 to 16 days in order to show some effect because every time you cannot use high ultra cal excess which is very expensive. You normal calcium hydroxide neo cal or rc cal, so that takes minimum more time compared to other calcium hydroxide, and usually the patient ignores instructions. Patient usually chews from the side from where you have done the root canal. Once the pain is gone, they start chewing, they put more pressure on the teeth, they start smoking pan gutka, everything is going on along with the root canal. So I usually give time because in my cases, whenever I have tried, it's my this kind of fast root canal. So, and I'm still astonished. Like first sitting, many of my patients like they say like that doctor does the root canal very first day, second day he does the crown cutting, third day deals the crown. Three done. But I since I practice only in the evening, and I rarely practice in the morning. So in the evening, if you want to finish a good root canal, one case will take case around 1 hour minimum. Okay, so usually what I do is irrigation. You should do a lot. One sitting I do only irrigation, nothing else with sodium hypochlorite. Even I have stopped using saline. Earlier I used to use chlorhexidine, then I used to use saline, then sodium hypochlorite. Now I only use sodium hypochlorite, which is available named Parcon from Septodont, and I give a temporary filling. So I will just give you a small tip. Temporary filling अगर use करना है, use Septodont's temporary filling is really really good. Okay, because it will never come out. Even in class 2 fillings, it never comes out. So Sympet Rose, the Symet Rose or Sympet Rose, the name is that. and I give that temporary filling, which is almost like permanent filling, and it never comes out, and the calcium hydroxide stays in place. And after the third, when the patient comes for the third sitting, I whenever I use the files, and at the time there is no pain, then I obturate. So if you what I would suggest, if you have started a new clinic, and don't compete with others, work at your own pace, and what work at your own rhythm, so that you do the best work, don't compromise on your work. And suppose you're not getting the canal, what to do? Sometimes it happens, na. So whenever happens, leave the patient on that day. Just whatever canal you have found out, just prepare that canal and leave it. You will see the second day you call the patient, no, 101% you will get all those canals. इट्स माय पर्सनल एक्सपीरियंस. अगर आपको कुछ से नहीं हो रहा है, अगर किसी दिन कैनाल नहीं भी मिल रहा है, जस्ट छोड़ दो उस पेशेंट को, लीव दैट पेशेंट फॉर द डे एंड सेंड द पेशेंट. So that's all with today's video, and I hope you like it. Follow me on Instagram. I post regular posts on white lesions and various CBCTs. So till then, take care. Bye. Good night. Have a great day.